Hello there, my name is Dr. Samuel Smith, and as you can tell from what I've already said, I am a doctor. I've been practicing my profession for 19 years, and the past 13 of which I have spent working as a parish surgeon in Leeds Infirmary, which is the largest hospital in Yorkshire. I see about 800 patients annually, and most of them are members of the poor working classes, so I do get to spend a lot of time with factory workers, people who've been around that atmosphere. And specifically the children who work in factories. It's awful what happens to them. You see, you don't have to be a medical expert to know that there's something wrong with a factory child if you see them. If you compare a factory working child to a normal child, I guess you'd say, you can see the factory working child is much more languid and weak. He looks, I guess you'd say, aged beyond his years. He's got an elderly atmosphere about him from all the work. You see, factory work can cause many deformities in a child. For example, when a child is young, around 12 or 13, his bones, specifically in his feet, are very soft, they're still forming. And these bones, they form arches in the feet, and these arches are responsible for supporting the entire weight of the body. And I've been seeing it more and more often where children who have had to stand for long periods of time while working in factories, the arches of the bones will simply give way. And sometimes it's irreversible. Another deformity is something called knock knees, which is actually where standing causes the knees to move inward and kind of buckle. And I saw one patient who lost 12 inches of height because his knees became so buckled through these knock knees, as it's called in the factories. But specifically, female children at the most risk for damage. You see, much like the male children, their bones are also still developing, specifically the pelvic bone. And long periods of standing, which they're used to in the factories, will cause the pelvic bone to become disfigured. You see, normally a pelvic bone forms sort of an oval shape, which helps with childbirth. It's where the child comes out of. But long periods of standing causes the spine to push down on the pelvic bone, and it causes the sides of the pelvic bone to push inwards, and this creates more of a triangular shape, which can often make childbirth extremely excruciatingly painful, or in most cases impossible. It's becoming more and more common for the doctor to actually abort the life of the baby in order to save the life of the mother, because it's simply impossible for the baby to come out of the pelvic region. It's terrible. But aside from growth problems, accidents, very common in factories and mills. I actually saw one patient not too long ago who got his hand stuck in some sort of machinery, and he actually chopped it into pieces all the way from the tip of his finger to this area right above the elbow. I've also seen skin ripped off so bad you can actually see the bone through the arm. It's just terrible, and that's why I want you to know that child labor is something that should be stopped. I'm asking for people to vote on a legislative bill that will limit the age of children that can work in the factory. And I believe that this will solve as many accidents, this will solve all the problems and stop the accidents so these children can live a happy and healthy life. Well, thank you very much for listening today, and have a pleasant day.